Breast cancer rehabilitation. Let's talk about early onset swelling or lymphedema. It's a hard word to say, lymphedema. And what it is swelling in the arm because the lymphatic vessels can't take the fluid or transport the fluid as it had normally done before surgery. Now, the particular lady that I'm going to talk about, she experienced lymphedema towards the end of her chemotherapy. And so she presented with swelling in the hand, and more so in the hand than the forearm. Now, this is an interesting onset of lymphedema. It's not typical. It's probably more related to the vessels and how they're struggling with the chemotherapy. So you know that during chemotherapy that the veins and the arteries really struggle with the chemicals. And so I imagine that the fluid is not being transported in the arteries and the veins, leaving a little bit more fluid in the tissue. And so that's where the lymphatic fluid is. And when the swelling occurs, it's because the vessels aren't capable of transporting that volume of fluid. So in this case, we just looked at putting on a compression garment. So to manage this early onset lymphedema, maybe all that's needed is a compression garment. So go to the therapist with the radiotherapy or your therapist within the breast cancer unit and get your fluid measured. By monitoring the swelling, then we can keep an eye on what actually is happening over time. So early onset lymphedema that may occur during chemotherapy and continue on through radiotherapy can occur for some women, but it doesn't mean that you will have this for a lifetime. So there's some research that says that early treatment with an arm sleeve resulted in a complete reduction of the problem. For this lady, we're not sure about the time frame. However, the treatments are there, so it can be using compression arm sleeve. It may require some massage techniques, some lymphatic massage techniques, which are different to massage. And it may require nighttime bandaging. But it's really up to the experience of the individual. So the aim of these presentations is just to give you a bit more information about what's happening to your body. Now, if you've found this helpful, then subscribe so that you can find this site again and you'll get the new videos as they come out. Because I think that if we know what's going on with our body, then we can look at the treatments that might be helpful for us to be able to get back to our normal life and our normal functioning.